With the pandemic that's been raging, there's a lot of concern regarding immunity. And I wanted to share a little bit of information from my book, Mindful Exercise. In chapter 6, I share a lot of research on how mindful exercise, such as Tai Chi and qigong and breath focused yoga and the like, can enhance immunity. Also, several case stories, and I'll share a few more here today. One of the things that enhances these exercises as you're going through the breathing exercises, the relaxed state of the body helps your body to really maximize the oxygen use in the body. And I'll share some of the mechanisms and what really brought my attention to what I call the metarobic effects of mindful or breath focused exercises. Things with looking at mindful exercise and how these exercises can benefit immunity relates to my initial observations in regards to the mechanisms and regarding what's going on in the body when you do these exercises. I had students in my courses, my classes at Fulton College that took the course for various condition. 3 of them took it because their cancer wasn't responding to treatment, and they're had read that Tai Chi might be able to help. I did some research in this area, and what I found is that there's definitely an oxygen or breath focused link between cancer and a lot of different chronic conditions, including compromised immunity and enhanced immunity. One of the things that's interesting is that what I found when researching cancer is that tumors use a sugar-based metabolism, glycolysis, and as the tumors expand, they distance the capillaries. And oxygen diffusion has a diffusing limit of about 10 to 20 cells. And as the tumors expand, you get that hypoxic or oxygen deficient area in there. Enhancing oxygen in the body, enhancing oxygen use in the body can really help combat a lot of different conditions. And researchers at Purdue in Indiana had created an implantable micro-oxygen generator that generated oxygen at the tumor site. And they implanted these in mice and rats. And they found that just increasing the oxygen diffusion in the area of the tumor shrank the tumor with no other treatment. So this really shows that, we need a lot more research in this area and find exactly how effective it is and how well it works. But a lot of those stories that people have of the healing benefits of Tai Chi, there seems to be some physiological underpinnings that may underlie that. So I started doing some research. I was thinking, it's like if you have these physiological effects, these dramatic effects, there has to be something measurable in the body that's going on. Something like with running, you can measure your heart rate. Well, if you're getting these kind of effects with Tai Chi and qigong and other breathing exercises, there must be something you can measure. And what I found is that your blood oxygen saturation increases during these exercises. Here is the resting level. And during the whole average of the Yang style Tai Chi, which includes some more rigorous movements, you get a statistically significant increase. The average is 96.84. Grasp the bird's tail, which is more of a qigong. It's all done in place, repeating these 4 movements in place. The blood oxygen saturation would actually increase to 97.86. I was curious about walking. Walking has a lot of health attributes, but unless you're power walking, speed walking, it's not aerobic. So I was curious, could walking have a metarobic or enhanced oxygen saturation and diffusion effect in the body? And I found that when you did walking with a focus on the breath, you're focusing on abdominal breathing and relaxation, you had actually almost similar to the grasp the bird's tail and other forms of qigong, 97.38. And even just regular walking, just regular pace, not speed walking, but regular pace walking, there was an increase. This compares to running. When you're doing running, you'll either get no change. This is a non-statistical decrease. Some of the measurements are a little bit above, some are a little bit below. This is the average. But when you're running, the large muscle groups demand the oxygen in the body. Those muscles need that oxygen to run, and they demand it over the use of the organs and the body, the whole fight or flight thing. It's more important to be able to run from a lion than it is to be able to digest your dinner. That's why you sometimes you get stomach cramps if you eat right before doing vigorous exercise. And I did get during vigorous running, and when you increase the heart rate, you actually got a statistically significant, consistent drop in blood oxygen saturation. And see this here looking at the change scores and from other studies from cycling and running compared to Tai Chi. But really brought my attention to how important this might be. I had left the oximeter on someone's finger, and as I went to remove it, I saw that their oxygen, the blood oxygen level started dropping, and it dropped down to 94, 93, 92, 91, and then it started going back up again. And I thought, okay, what the heck is going on here? Your blood oxygen saturation, normal ranges are between like 90, 95, 94, and to 99. And anything below that can be a cause of concern, particularly if it's consistent. So I was curious, why did we get this drop? So I started doing more measurements, and I found a statistical decrease in blood oxygen saturation following the Tai Chi form within a minute or two afterwards, sometimes as low as 88. I've actually gotten some measurements since I did this study as low as 84%, and then it returns back to normal. During running, you either get no change or a slight drop, and then it goes back up. During Tai Chi, you get that increase, but then afterwards, you get that momentary drop. And that momentary big drop in blood oxygen saturation indicates that your body is using oxygen in a very different way than other forms of exercise. And you use oxygen in your body for healing, for metabolic function. And this may explain a lot of the healing benefits of Tai Chi and similar exercises for immunity and cancer and other conditions. So returning to immunity, hypoxia, oxygen deficiency, does affect the production of T cells in the body. There have been a lot of studies in this area, and T cells are important. There's three main types of T cells. One of them is a cytotoxic, what they call killer cells. It creates this cytotoxin that kills viruses. And so these T cells can be affected by oxygen deficiency in the body. And it's important for inflammation as well. I started researching, looking more recently to see how this might relate to the current pandemic and the coronavirus. And I found that there is actually some very significant implications relating to oxygen deficiency in the body. The coronavirus, and specifically, there's some concerns the way it can invade brain cells. It hijacks, makes copies. And researchers also notice that it seems to suck up nearby oxygen, and it starves the neighboring cells to death. It creates this hypoxic area. 40 to 60% of those who experienced have had coronavirus experience some sort of neurological or psychiatric symptom, which is why, possibly from inflammation. And Tai Chi breathing exercises have been shown to be very effective for treating inflammation and chronic pain and chronic inflammation. National Geographic had a wonderful article looking at the science on the coronavirus. And they also noticed that people with the coronavirus, they call it silent hypoxia because they don't struggle to breathe. There's no shortness of breath. You don't notice that your body's short on oxygen. But COVID-19 is starving your cells of oxygen. And again, they call it silent hypoxia. It was initially overlooked. And I've seen measurements with the oximeter where you can see people look totally healthy, totally normal. You put the oximeter on the finger and you'll see that their oxygen levels are around 91, 92, which is not a normal level. And it turned out that they had the coronavirus. So there's an indication that deep breathing, they're showing that deep breathing techniques could help you recover faster from COVID-19 because it helps reverse hypoxia. It gives your body the oxygen you need to fight it. And Dr. Mazes with the integrative medicine at the University of Arizona had, along with a colleague, had looked at the different benefits, specific benefits that breathing practices and qigong, which is a type of breathing exercise, can have. And she and her colleague found that regular intentional breathing, focused on relaxation, focused on abdominal chest breathing, maximizing bringing in the air in the body, focusing on relaxation, that it can, one, reverse the tendency to scar the pulmonary fibrosis and increases the lungs' capacity to provide oxygen. Canadian researchers, she noticed a study by Canadian researchers that are actually prescribing breathing exercises for COVID recovery. And they're prescribing these exercises to be practiced 1 to 3 times per day, up to 10 minutes each time. China, they had 20 recovering COVID-19 patients. And these patients had such a significant decrease in shortness of breath and increased physical ability and quality of life that they continued to perform these exercises even after they recovered completely. So these are wonderful exercises. They increase your vitality, they increase your energy, they increase just beneficial for health on a whole range of aspects. In my book, I cite several studies. I'm going to present two of them here that I think are more particularly significant in looking at how do exercises, specifically like Tai Chi, how does it affect the T cells? And in this study conducted at California State University, Los Angeles, group one, who practiced Tai Chi, had a 50% increase in their T cells. Group two was given the shingles vaccine, and in this group, they had a 75% increase. And then poor group three, they didn't get anything, no vaccine, no Tai Chi, and they had, just as a comparison, and they had no significant change. And found that just practicing Tai Chi resulted in a significant increase in the virus-fighting T cells. In this group, this study was done at the University of Illinois, and they're curious what happens if you give the vaccine to a Tai Chi group. And when they gave the vaccine to a Tai Chi group, the shingles vaccine, they had 173% increase in antibodies at the 3-week follow-up. The vaccine group in this study had a 50% increase in antibodies at 3 weeks. And again, a comparison group, which resulted in no change. What was really interesting was that the 20-week post-vaccine measure, the vaccine and Tai Chi group still had a 109% increase in antibodies, whereas the vaccine-only group had a 10% increase in antibodies. It still helps, and it's still very important to give vaccines, but it shows you the importance of maintaining health, whether it's through regular exercise, running, and the like. Any kind of exercise improves health, but these breathing exercises may have that additional benefit of enhancing oxygen metabolism, oxygen diffusion in the body, oxygen saturation in the blood, which may provide that additional layer of benefit for some conditions. And the authors in this study noted that this is particularly important, or maybe particularly important, for those viruses for which there is no vaccine. And we're developing one's soon to be released, hopefully, with the coronavirus. But until you can get that, or if other viruses, as they come along, that there's no vaccine for, they said this may be an important exercise to consider promoting because it helps your body fight these viruses. So the studies are important. You need to see the statistical evidence. But I find very motivating looking at people's personal stories. So I've included several stories from my book here and others that I've found on the web. In Catherine's case, she would become bedridden every year for a couple of weeks at a time, 6 to 7 times a year with some type of illness. She just had a very poor immune system. And since learning Tai Chi, she reported being sick only 3 days in a year and a half. And this is very common among people. I know with myself, when I'm been very consistent with doing Tai Chi daily, with the celiac neuropathy I developed, I started doing it twice a day, which reversed that. But I have not been sick in 15, 20 years from a cold virus. Again, see your doctor and use precautions and talk to your doctor if you're interested in this. But it's interesting to see, again, these case stories can sometimes give you some motivation to look into the research and to provide further research and to talk to your doctor about these things. Lexi, again, you got to use precaution. You can't, I wouldn't go out and mix with people I know have coronavirus. I feel like Tai Chi helps protect me and the qigong, but I'm not going to, take extra risk because of that. But Lexi noticed that she just feels confident that she's not going to get sick. And she does say that part of that might be mental, and that whole expectation effect, the placebo effect, just thinking something might affect you can affect you. And with the mindfulness that comes along with mindful exercises like Tai Chi, you tend to lead a healthier lifestyle on a lot of different issues, reduce stress, which can have a big impact on immunity. Dale got 2 to 3 severe colds every year, lasting 2 to 3 weeks at a time until he started Tai Chi. Dale still gets colds, 2 to 3 colds per year, but the severity and duration has diminished. And one of the things that would have been nice in these case stories is people write in response to letters, blogs, different on Facebook, you find these stories, and they don't always give you a lot of details. So how much was Dale practicing versus Lexi? How much is Dale practice versus like my own practice? Does the amount of time, what I call the dosage, the frequency of practice, the time of practice, would that affect it? But it's still nice to see that this has helped enhance his immune system and reduce the severity of that. Here's a practitioner who has been doing Tai Chi for 10 years. And he says during that 10 years of daily practice, he's never been sick, even in continuous contact with other people who've had whatever cold or flu is going around. Again, with the coronavirus, I recommend, maintain that social distancing, maintain those masks. but it's nice to have that confidence that you do have potentially a significant additional layer of protection. Again, another area we need more research in, but the initial research and the case stories are very promising in this area. Wendy, with hepatitis C is a virus that she had severe migraines, headaches, and chronic pain. And when she started Tai Chi, she over the time period she's doing it, she was able to get rid of these. And one of the consistent benefits that have been cited in numerous studies for different conditions are benefits for chronic pain. She's benefited in many ways. Medical tests are improved. Her liver pain is gone, as are the muscles and joint discomforts. And she feels it's given her life back. One of the more dramatic case stories. This one's also in my book. Bruce had a heart attack, followed by 4 years of flu, bronchitis, and pneumonia. And then he had a second heart attack. And that served as his wake-up call. He really needed to get serious about his health. And so he started Tai Chi among his different health routines. And for the last 2 years, he's been very healthy. And he's convinced that the Tai Chi was the main component that played a part in that. And that his health will continue to improve as he continues his Tai Chi. And CG had asthma in the past, yearly bouts of pneumonia. Since taking up Tai Chi a few years ago, she's had better control of the asthma. Tai Chi's improved the balance in both body and life. And I have one or two more here. This person just abbreviated as L. Bad pneumonia left this person with a lot of lung damage and massive infection. Again, we're talking about the scar tissue, which these exercises, the deep breathing can help with. Medication, feeling sorry for themselves, and then tried Tai Chi for rehabilitation. There's more people offering rehabilitation Tai Chi courses. And not only did it make them feel better, but it had them feel like they're back in charge in life. Just taking a step to take a proactive step in your life can really help. So on the Metarobics YouTube channel, I have several exercises that can introduce you to that. One of these is the 8 pieces of silk brocade, but Duanjin. It's sometimes called the 8 treasures because this exercise has been around for over 1,000 years. There's stone carvings of these exercises, and it's a very simple 8 routines that really focuses on systematically enhancing the oxygen use and the flexibility and the strength of the body. On the YouTube channel, so click with the pointers on. Okay, I guess, well, on the YouTube channel, I'll take you through these exercises. And as the arms raise up, the rib cage expands. You do the abdominal breathing. It just brings in a lot of oxygen. You'll feel a tingling in your hands and arms, just like when you're sitting on a leg and it falls asleep, you get that painful tingling as the oxygen returns. But this is a very pleasant tingling as you diffuse oxygen throughout the body. You can actually feel that as a tingling in the body. So if you're interested in more information, the Mindful Exercise from YMAA Publications has a lot of information on the research underlying this, looking at the different chronic conditions in the body from cancer, diabetes, immunity, chronic pain, arthritis, just different research. And again, case stories. I find there's over 50 case stories in the book. So I find reading about real people and their experiences with this can be very motivating and really insightful. And then I also have a book on the mental aspects, the mindful aspects in regards from a more traditional aspect, which is a special edition that's currently not in publication, but is available on Amazon. And I've used this with different groups of people, and the response has been very positive in regards to developing levels of self-mastery and understanding some of the philosophy of mindfulness. And then if you're interested on classes via Zoom, would be interested in a presentation or workshop, feel free to email me. I present these workshops at various conferences across the nation, and have worked for different schools and prison education programs and the like. I'm always happy to share. We can discuss any interest along that area. So if you have any specific health concerns or considerations, make sure you talk to your doctor before beginning any new exercise. But this is an exercise that a lot of people have found can really benefit their health in a lot of different ways. I have celiac disease, and I developed celiac neuropathy where I couldn't feel my hands and legs, and I never had the pain that comes along with that, I think because I was doing Tai Chi pretty much every day. But when I adjusted it based on some of that research I was doing with the Metarobics and how to enhance and maximize oxygen saturation in these exercises, all the feeling returned back to my arms and legs. And again, they're very powerful exercises. So I recommend giving it a try. There's a lot of resources in the community. You can check out the resources on the Metarobics YouTube channel. And in the future, I'll cover some of the different elements and chapters and conditions from my book.